Patrik Hutzel here from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units at home, whilst providing quality care for long-term ventilated adults and children with tracheostomies at home. We also provide care to otherwise medically complex adults and children at home, including home BIPAP, home CPAP, home tracheostomy care when adults and children are not ventilated, also home TPN, home IV potassium infusions, home IV magnesium infusions, as well as IV antibiotic infusions at home. We also provide port management, central line management, PICC line management, Hickman's line management, as well as palliative care at home, and that also includes ventilation, weaning. We are also providing our critical care nurses for home care to avoid emergency department readmissions. We have done so successfully in the past for the Western Sydney Local Area Health District, the In-Touch service, as part of a successful tender. So today I actually want to talk about that I watched a presentation recently from the ACCCN. The ACCCN is the Australian College of Critical Care Nurses, and the webinar or presentation was about end-of-life decision-making in ICU and the law. And it talks about the law and end-of-life decision-making, but I found a very interesting comment in the presentation was that in ICU, some patients die an undignified death. Now, I have worked in critical care for nearly 25 years in 3 different countries where I worked as a nurse manager. In ICU for over 5 years. I've been setting up intensive care at home here in Australia since 2012. I've worked in intensive care at home in Germany. So, I draw from a wide array of experience, and most ICUs still can't think outside of their ICU bed spaces, saying that patients in ICU may die an undignified death. And I agree with you. I have seen many undignified deaths in ICU over the years. But the solution here is to think outside of what ICUs perceive as an undignified death. Well, there is a dignified death at home. When you look at the statistics, 75% of people want to die at home, and yet less than 15% of people do die at home, right? And that's simply a result of lack of services in the community. It's a result of lack of creativity. It's a lack of hospitals talking all about community care but not doing anything about it. ICUs in particular are 30 years behind. It's been happening in Germany and in Europe for the last nearly 25 years. And in Australia, we are obviously providing intensive care at home here, and we have been since 2012. But, a lot more could be done. And patients in ICU do not need to die an undignified death in ICU. They can die a very dignified death at home with a service like intensive care at home, right? And that includes one-way extubation. We have done one-way extubations at home, right? It can include weaning inotropes off at home when it's end-of-life care, right? But the bottom line is, from my point of view, after having worked in critical care for nearly 25 years, there are really only undignified deaths in ICU, because once end-of-life care, has been agreed on, then death can and should happen at home. And that would provide a win-win situation. For example, an ICU bed costs $5,000 per bed day, right? Let me repeat that. An ICU bed costs $5,000 per bed day. In some areas, probably closer to $6,000 per bed day. And ICU beds are the most sought after bed in any hospital, right? ICU staff, doctors, nurses are highly sought after. So why would we keep blocking up beds in ICU with, when end-of-life care or other care, like we do with long-term ventilation, tracheostomy, can be provided at home? Why do we keep blocking up ICU beds if there's a better solution with home care anyway? And like I said, research has shown 75% of the population want to die at home, and yet less than 15% actually do. When do we actually start listening, right? When I worked in ICU at the bedside or as a nurse manager, I always believed that there must be a better way than end-of-life care in ICU. There must be. Well, we found one here with intensive care at home. Thank God for that. but we can do more of it, and we need to do more of it to help hospitals to unblock their beds, to cut down surgical waiting lists, to cut down wait times in ED, and the list goes on. But also we're cutting the cost of an intensive care bed by approximately 50%, right? Imagine that. And we're freeing up an ICU bed, and families and patients want to be at home. It's a win-win situation all around. And I encourage all hospitals and ICUs to reach out to us, and families to reach out to us if they have a loved one in ICU with end-of-life care, and they don't want to have end-of-life care in ICU because it's just dehumanized often, right? And at home, it is simply a personal approach, right? So I hope that sheds some light on more on our service and what we can do. Now, with intensive care at home, we are currently operating all around Australia in all major capital cities, as well as in regional and rural areas. We are an NDIS approved service provider all around Australia. We are a TAC approved and WorkSafe approved service provider in Victoria, iCare in New South Wales, NIISQ in Queensland, as well as the Department of Veteran Affairs approved service provider all around Australia. We have also received funding through public hospitals, departments of health, as well as private health funds. So reach out to us at intensivecarehome.com, call us on one of the numbers on the top of our website, or send us an email to info@intensivecarehome.com. And if you, like I said, if you have a loved one in intensive care, you know, you want to go home because they're stuck in there, whether it's end-of-life care or whether it's long-term weaning, ventilation, tracheostomy, BIPAP, CPAP, Home TPN, central line, Hickman's line, PICC line, port management, we can do all of that at home. It's much better, much more cost effective, and so forth. Now, and if you're at home already on ventilation, tracheostomy, you need palliative care, and you're not having enough support, I encourage you to reach out to us as well. And like I mentioned, we're also sending our critical care nurses into the home or into residential aged care to keep emergency departments empty and avoid emergency department presentations for our clients. And if you want that for your loved one or for your hospital, then I encourage you to reach out. We have done this successfully for the Western Sydney Local Area Health District for the InTouch program as part of a successful tender. Changing nasogastric tubes at home, PICC tubes at home, catheters, IDCs or SPCs at home, changing tracheostomy tubes, changing casts even. Anything that can be done at home, we have done really. And when we change nasogastric tubes, for example, at home, we also have the option to do home x-rays with mobile radiology, and they will do x-rays at home. Shout out to Michael Montalto and his team. Now, and if you're at home already and you're ventilated, like I said, and you have insufficient support, you know, ventilation, tracheostomy, BiPAP, CPAP, and so forth, and you might have support workers instead of intensive care nurses, which could really be a death sentence. And I'm not joking here. I have evidence for everything that I'm saying here to back that up. You should reach out to us. We can help you with intensive care nurses. They all have a minimum of 2 years intensive care experience, and you get evidence-based services and not services that are based on support workers, you know, that can't look after ventilation, tracheostomy, that have no training whatsoever, right? And if you need more funding, reach out to us. We're also providing level 2 and level 3 NDI support coordination, as well as TAC, case management. And if you want to know more about level 2 and level 3 NDI support coordination, please reach out to us as well. I've actually done an interview with Amanda, our NDI support coordinator, and I will link towards the interview. And if you're an NDI support coordinator working for another organization and you're looking for nursing care for your participants, please reach out to us as well. We are also providing NDI specialist nursing assessments, and we're providing nursing assessments for any other funding body or organization if you need them, especially when it comes to very complex ventilated and tracheostomy clients in the community or in ICU and in hospitals. And if you're an NDI support coordinator struggling with getting nursing care for your participants, please reach out to us as well. Once again, we have been successfully involved in the advocacy for our clients for nursing care at home from day one. And that's also applicable if you're a family member or a patient who can't get nursing care through the NDIS. Please reach out. And if you're a critical care nurse and you're looking for a career change, we want to hear from you as well. If you have worked in critical care for a minimum of 2 years and ideally you have completed a postgraduate critical care and nursing qualification, we want to hear from you. We currently have jobs in Melbourne, Sydney, Brisbane, Albury, Wodonga, Bendigo, in Country Victoria, in Port Macquarie, as well as in Warragul in Country Victoria. Please keep in mind, we're looking for critical care nurses that want to complement our team, and we want to hire staff that give us regular availabilities, because that is what our clients want. Our clients want regular staff. That's why we can provide a tailor-made solution for our clients and their families, and that is what we are providing. And if you are an intensive care specialist or ICU consultant, we are currently expanding our medical team as well. We want to hear from you. And if you're an ICU specialist or ICU consultant and you have bed blocks in your ICU, I encourage you to eliminate your bed blocks, because we can help you do that. But more importantly, we improve the quality of life and sometimes quality of end of life for your patients and their families, and you won't even pay for it. So they don't have to die an undignified death in ICU. And if you're a hospital executive watching this, we also want to hear from you, because once again, we can help you eliminate bed blocks in ICU, ED, respiratory wards, etc. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. And if you're in the US or in the UK or in Canada, please reach out to us as well. We can help you there privately. And if you like my YouTube videos here, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. Share the video with your friends and families. And I also do a weekly YouTube live where I answer your questions live on a show. And you will get notification for the YouTube live if you're a subscriber to my YouTube channel, or if you're a subscriber to our email newsletter at intensivecareathome.com. Go there and subscribe now. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.